Before we transition to the skull, let me show you side by side. We've talked about the petrous portion of the temporal bone, the ridge. That's where we've been looking on the ear model. But one distinctive thing that makes the ear especially difficult is that these ridges are not 90-degree angles to the planes we're used to. We're used to saying just medial, lateral, anterior, posterior, but if you see, these ridges are at more of a 45-degree angle to the planes we're used to dealing with. I've turned this model to reflect that, so it should line up with the left petrous portion of the temporal bone in the skull. Left petrous bone. The last thing I want to point out on the model is that this semicircular canal, this is the anterior semicircular canal, this is the most superiorly projecting semicircular canal. And it actually forms a bump that we can see on the skull, and you can see this on the skull model or the skull. Well, I'll point this out again when we zoom in on the skull. But it's called the Arcuate Imminence. It is a bump on the petrous portion of the temporal bone. Now I'm going to remove the model, and we'll focus on the skull. Once again, we're looking at the petrous portion of the temporal bone, the left specifically. If we see, on the posterior aspect, you can see that internal auditory meatus. Which nerves enter here? Or I should say, which nerves exit the cranial cavity through this hole? That's right, 7 and 8. Anteriorly, we can see a few familiar foramina. The foramen spinosum, which transmits the middle meningeal artery, that's your epidural hematoma artery, and the foramen ovale. We should know what that is now. It transmits what branch of the trigeminal nerve? That's right, the mandibular. I'm pointing these out right now to use as landmarks so that we can use these to locate where we would expect to find the cochlea and the semicircular canals. If we draw a line between the foramen spinosum and the internal auditory meatus, we would cut through a portion of the cochlea. If we move laterally, we can see a ridge. It is called the Arcuate Imminence. And that Arcuate Imminence denotes the anterior semicircular canal. See if you can find these on your skull or plastic skull model. I want to point out another feature that will help us later in this talk. And that is actually the hiatus for the greater petrosal nerve. Running anteromedially from that, you can follow a groove called the groove for the greater petrosal nerve. On this skull, it's painted yellow, but this groove is discernible on all the plastic skull models as well. You can see that on pages 9 and 11 of your Netter Atlas. Now, if I place my probe on the hiatus for the greater petrosal nerve and draw a line over the internal auditory meatus, then I would probably be going through the vestibule between the cochlea and the semicircular canals. Let's look at the right side of this skull. On the right side, the bone has been cut away in some places. Here, we can actually see the ridge that was left in place, the Arcuate Imminence. And just deep to that, painted in blue, you can see the groove that is the semicircular canal. As I said, the internal ear is actually an open space in the bone. When you see a model of the internal ear, you're looking at a representation as if we poured plastic or wax into a cavity and pulled that out. So this semicircular canal here is a tube. The internal auditory meatus is right here, and the foramen spinosum right here. So if we draw that line between the two, I can see right here the cochlea. We have actually cut through the cochlea so that you see several little openings as if you've bisected a snail shell. Right there at the middle would be that center where a tube has been rolling and winding around itself. Here's the cochlea. So we know if the cochlea is here, semicircular canal here, the vestibule would be in this region right here, connecting the two. Now I pointed out here the anterior semicircular canal. That's the one that reaches most superiorly to form the arcuate imminence. If we look lateral, here's the arcuate imminence. Lateral, there's a hole in this skull. They've drilled down deep and found a groove that is the lateral semicircular canal. And here actually is even a better view of the cochlea. Can you see that? And we see that the cochlea is, of course, medial to the semicircular canals. It's counterintuitive. A lot of people, even though they have known it before, tend to forget that. Now I'm going to turn posteriorly. Hang on. If we look excuse me, we're looking at the posterior. Here's the petrous ridge of the temporal bone. We're actually looking in the posterior cranial fossa here. There's your internal auditory meatus, where cranial nerves 7 and 8 exit the cranial cavity. And we can see lateral to that, we've shaved away some of the bone from that petrous portion, temporal bone, and you can see the posterior semicircular canal, painted in blue. And where we started, back to the anterior, and then there's the arcuate imminence. A lateral view of the temporal bone of the skull. We can see outlining the temporal bone here. And we see the external auditory meatus just anterior to the mastoid process. I would like to remove the temporal bone so that we can get a look at the middle ear. So that we can remain oriented, I'm going to turn the skull, and you can see where the temporal bone was. So move the skull out of the way. We see what we were just observing a moment ago, the ridge, once again, the petrous portion of the temporal bone, the familiar anterior semicircular canal we were talking about, and medial to that, the cochlea. Now, remember, over here, where you can see my yellow pointer, we will find the external auditory meatus. There's the external auditory meatus. Now I'm going to we'll bend open the temporal bone. So now we are looking from the opposite direction. We are looking out toward the external auditory meatus, and I'm actually pointing at the tympanic membrane. Let me grab a more stable grip of this. Tympanic membrane. On the tympanic membrane, you can actually see there the head of the malleus and the arm of the malleus. So you can see when the tympanic membrane vibrates, it will move the malleus. If we look closely at the malleus, you can see space around it. Tympanic membrane. We can see on the tympanic membrane the arm of the malleus, and here above it you can see the head of the malleus. Just to orient us, once again, this is the mastoid process. You can see the styloid process here. So this is just posterior to the external auditory meatus. Back to the malleus, you can see just above the malleus an open space around the head of the malleus. This is called the Epitympanic Recess. And the roof over the middle ear cavity, we can see is a very thin layer of temporal bone. That is called the tegmen tympani, or the covering of the ear, the roof of the ear. Now with this epitympanic recess, if you move in a sort of posterior lateral direction, you can see there's a bigger opening here. We call this the mastoid antrum. As you can actually see in this particular case, that this is continuous with some of the spongiform bone of the mastoid process. And thus, infections in the middle ear cavity can actually spread into what we call the mastoid air cells and must be addressed when addressing long-term middle ear infections. Back to the middle ear. If we move anterior medially, and this would be moving parallel to the ridge of the petrous portion as if we're moving moving toward the nasal cavity, you can follow what we pointed out on the ear model, the tensor tympani muscle. Right there, it's hard to see, but there's a line that should be representing the tendon that then inserts on the arm of the malleus. Thus, when we constrict that muscle, we pull on the malleus and hold it taut so that it cannot vibrate back and forth as vigorously when the tympanic membrane vibrates with sound. Now, following the tensor tympani muscle, anterior medial direction toward the nose, we can see that inferior to it there's actually a groove or a tunnel. It's actually a tunnel, but since we cut the bone right here, it's more of a groove. This represents the open cavity in the bone where one would find the eustachian tube, the pharyngotympanic tube. When you look at this in pictures in your atlas or on the model, you can see that the eustachian tube is always parallel to and inferior to that tensor tympani muscle. I'd like to look at the pharyngotympanic tube in a few other ways. Let me close this temporal bone again. I'm going to turn around this way. Recall the groove of the greater petrosal nerve. There's the hiatus of the greater petrosal nerve. Find this on the skull model. Here's the groove of the greater petrosal nerve. Just deep to this, one finds the tensor tympani muscle as we saw. So follow, as I open, you can see this margin right here parallel to that groove. So as I pull back, we're going to see along this margin the tensor tympani muscle we were looking at. So when you look on your plastic skull and you see the groove for the greater petrosal nerve, you know that just deep to that, just anterior and deep to the bone, you'll find the tensor tympani muscle, and then just inferior and deep to that, you'll find the opening that is for the pharyngotympanic tube. Now, I'd like to look at this on the inferior aspect of the skull. In a moment, we'll put the skull back together and look at that. Right here is the muscle we were just looking at. But now that we've closed the skull, you can see there's the muscle. We close the skull. We see it right here. Now, I'm going to put the skull back together and come back and point at this again. We can see, looking at the base of the skull, right here we actually have the nasal cavity and the nasal septum dividing the nasal cavity. So we know just posterior to that is the pharynx, the destination of the pharyngotympanic tube or the eustachian tube. It will open into the pharynx right here. You can see a picture of this in your Netter Atlas. Let's look back where it's coming from the ear. Recall a moment ago we were looking at the tensor tympani muscle, and you can see that right here. This is where it was exiting when we had pulled the temporal bone from the skull. You can see right here is the fault line where I had pulled the temporal bone from the skull, and we were looking at the tensor tympani coming right out from that. So let's familiarize ourselves with where we are. First of all, this is the foramen spinosum, a familiar item we should all know by now. This is a sort of different looking foramina valley. As we can see, it was not complete. We know that for the mandibular nerve. And here is the canal for the carotid artery, internal carotid canal right there. So between the carotid and the foramen spinosum, you can find where the tensor tympani muscle and the pharyngotympanic tube would arise. So right here, just inferior to the tensor tympani muscle. In this picture, since we're upside down, inferior would be here. This tube then runs anteromedially toward the pharynx. So let me refresh. What foramen is this? What foramen, oops, not a good view there. What foramen is that? Right next to this one. Ovale and spinosum, they're right next to each other. So the pharyngotympanic tube is running just posterior medial to those two foramina. Oops, sorry, depth. Let me see this again. There. All right. One other landmark to point out for helping find this is the spine of the sphenoid bone right here. So you can see it's just deep to the spine of the sphenoid bone.